Awesome achievement.
Honestly, sir, kind of relieved because my May result was totally not good. So I had some pressure to actually perform well in this one.
So can you share, beta Chetan? Can you share your journey? Like all the medicos who are listening to us, we are having a proud moment where Dr. Chetan is with us on this platform, and we are sharing his success journey for upcoming examination. So, beta, how like when you joined DAMS? Like, let's start from the basic start of the journey.
Sir, I joined DAMS back in third year
Okay, beta.
uh, mm, for the foundation course. I think it's called foundation course, right? For the third
Yes.
and fourth year subjects. So in
Mm-hmm.
starting, I was actually following the classes. I think I did the math and opthal and some. But eventually, I actually thought in the mid phase, I actually thought that this career is might not be for me, and I actually thought of switching careers to some other. I was
What,
actually
what, what,
considering UPSC for.
why,
I was
beta?
actually,
I didn't get this point.
uh, I don't know, sir. I think I thought that maybe medicine as a career might not be for me. I actually considering UPSC for quite some time till late in my internship. So I actually was
Okay,
researching
beta.
about that, and I was not actively preparing for PG exam. I did academically good in my prof years, in third and fourth years. I did academically good, but I was not very much focused on PG preparation till this May. So that's why I actually did not perform well in the May INICET and even in NEET PG for that matter. But
Okay.
then when I actually decided that no, I want to do medicine only, then I started seriously preparing for the exam from May.
So, beta, how you proceed? Like in the final year, you joined, but you were somewhere deviated. "Okay, I want to concentrate on the UPSC examination." You
Yes, sir.
appeared for your prof. What was the source of your preparation in the prof bit?
Since prof, my source of preparation was mainly the standard books only, because even
Yes.
because even DAMS says that reading standard books is the best thing to do. And I also also checked out the last 10-year question papers on how the papers are designed. And when I actually had some difficulties in understanding the concepts on the books, I did refer to the DAMS notes I had made back at that time.
Okay, beta. And like you appeared for the final year examination. So how was your performance in that exam, beta?
So actually, I topped the exam in
Oh,
my college.
that's great. That's great. So, but it means that like your marks in the prof examination, you were the topper. It means your basic concepts were very strong. Now you
Yes,
are
sir.
getting
I think
this.
that matters a lot to keep the basic concepts right, and that was because I was actually attentive in my college lectures and also in group discussions in my college. That helped a lot in the exam also, because these minor
Very
nuances are what is asked in the INICET exam. Nobody will teach you this directly. You can only gain this from attending the lectures and
discussions. Yes,
participating in discussions.
that's very true. So, but what I'm getting from you in the first the discussion last few minutes, okay, we should read the gold standard books. We should not miss the books. Second, if we discuss, if we go with a group study, it helps a lot. Definitely, but very
Yes,
true.
sir. I actually was more towards the group discussions rather than studying the books because I'm not a very good reader of. I don't like reading books that much, but I like discussing those books much better.
That's very nice, Beta. So now, like Beta, you are having INICT rank 108. If I ask you which are the prime subjects where the student should focus, the
So I
first
think
question
this
is
NACT proves that first of all, you should be ready to have unanticipated changes in the
yeah,
pattern of INICT because this NACT actually because it changes every year. INICT decides to give prime focus to any subject any year. You cannot anticipate it. So it's good to have a grip on basic concepts of all the subjects. But yes, having grip on basic sciences is what actually serves you a lot. If you can have that. First and second is actually lay a good foundation for your INICT exams.
that's very true.
Yes. Apart from that, in third year subjects, I would say PSM is important because it's a vast fact heavy subject, and you have to give multiple revisions to actually master that. Apart from that, final year ops gyne is very important because ops gyne is totally different subject. You cannot extrapolate any concept from medicine or surgery. You have to study that at its own face value.
PSM, OBGY, and your basic science. They should be very strong. And we agree with you. But every year there's some more focus on one subject. Like this year, they have asked more of ophthalmology, ENT,
Yes,
these
sir.
MCQs on the higher side.
Uh, Opthal and ENT is actually considered to be the last subjects to be read, but this time they actually flipped the tables with
Yeah, flip the
Opthal and ENT, and people were actually devastated at what happened.
So now, beta, like after your prof examination, after getting top ranks, like you join our TND batch, how was the experience of test and discussion course? After foundation, you appear for TND. So how was the experience there? What was the role of TND in your success journey?
So to be very honest, I was not able to follow the TND batch uh, very religiously because I was actually debated at a time that should I
Okay,
switch careers or should I not. I will be very honest about that. But yes, occasionally when I did that, the question actually the game of INICET is the question pattern. You can have all the knowledge in the world, but if you can't crack the question at the right time, you cannot move, cannot get a good rank in the exam. So that's what TND helps you in that it gives you the question pattern that how will they ask the question. Unless you know that you cannot actually succeed in these exams, there's absolutely no point to prepare like that. It's more important to do questions rather than to read the theory. So that's what
absolutely.
TND exams, TND programs can help you with.
So what
And
was
this,
your
this
strategy? Like you attend any TND, like say you attend pharmacology. So what was your approach? How, well, you used to take one TND period.
uh, with any TND, the basic concept would be first I give the test regardless of my preparation level, just to see if things are in my long-term memory. And I don't care what the score is. I just point out what my mistakes were. If it's a factual mistake, if it was a conceptual mistake, if it was a silly mistake, you have to divide your mistakes like this so that you can actually improve on these. After this, the discussion helps you because it can tell you all the PYTs related to the question. Because every question itself can tell you about four topics from the four options. And you can note this down in a notebook if you want that. I usually didn't. I usually try to remember more. I usually try to write less and watch more or listen to the teacher more so that I can store it in my brain. That
So,
was the
beta
basic
Chetan,
concept.
yeah, I just want to discuss one more thing. Like after this INICT result, every student is saying, okay, if you the concise notes were the game changer in this INICT because paper was more of like neat pattern. But I get the message from all these students, okay, the INICT paper was not typical aims or lengthy MCQs. It was
Yes, sir,
rather
it
more
was
of
more of a single liner paper. But then again, we have to consider that INICT is actually a very unpredictable exam. Just because it
absolutely,
was like this time, it's not important necessary that they will give the same pattern again in the May INICT. They might switch to the clinical pattern. What will the students do then? We have to be prepared for both the clinical long stem questions and the factual based questions because the long
absolutely.
stem questions are only factual based questions, just the long paragraph.
So when the pattern was changed, now the paper was somewhere on the neat pattern. So what was the
Yes.
role of concise notes, or what when you attend our DVT, that those notes of concise, ultra concise notes of DVT, how they play the role in your rank?
So concise notes help by reiterating the important points again and again and again because after all the question is going to come from the same point. Rather they can give it
Absolutely.
in 5 lines, they can give it in 1 line,
Mm.
but the question is going to come from the same point. That is important to realize. That's why running after too much content is actually an idiocy because of course you cannot remember everything. It's important to remember the basics and maybe some advances so that you can even rule out options. And it's easier to cover the concise content over the expanded content any day, and it gives you confidence to attempt questions.
Any special moment with of DVT or TND, which you just you can share here on this platform, which help you in the examination
Uh,
hall,
I specifically like Dr. Sheena Chandramani's
medicine doctor,
rheumat and nephro lectures because first of all his writing is so amazing, and apart from that he
he's
makes the
best in
algorithm so
writing.
easy that
Mm.
actually he makes the algorithm so easy that it's actually easier to attempt the questions, however lengthy it is, however clinical it is, however values you get, but it's actually quite easy to attempt the questions.
Like, but now I will be taking subject wise, like take you medicine and surgery. What should be the approach? The student, like I take next few minutes for the final year students who are preparing for upcoming prof exam as well as their NEET exam. What should be the strategy? How to handle the final year subjects, beta?
Okay, see, sir, for prof exams, I will actually say that you do not need to do too much. You can always pick up the last 10 years. The people sitting and making this exam always like to repeat the questions. They will just change some words here and there. You can just do the last 10 years and you can go and get done with it. As long as you have a basic understanding of what's happening in the disease. Yes, but from the competitive exam view, INICET does not focus too much on medicine for some reason, or at least you can do away with it with basic sciences, except some questions. But NEET PG actually focuses on medicine a lot. You do need to have a good understanding of medicine apart from in that. But surgery, so INICET focus on surgery quite a lot, except especially image-based questions. You do need to have a good command of image-based questions. You need to identify nerves, muscles, the views that you are getting, because now they are focusing on much more live images, like the intraoperative images they are using now in INICT. So you need to have a good command over that. You can't expect that they will give you a figurative image, an animated image anymore. They'll give you real images. You have to identify structures in that. So you do not need to be scared by that. You just have to practice, and it will eventually come in your flow to solve those.
Very nice, Peter. Thanks for sharing all these words. All the medicals, we are having the privilege to have Dr. Chetan with us, rank 108 in the last INICT examination. Like, Peter Chetan, you say in the last NEET, last INICT, your performance was not up to the mark. I am asking what you did in those days after your NEET result. Like, you were not satisfied with your rank 1 month before, like 30 to 40 days before the INICT. What was your strategy?
So this INICT 13 40 days.
This one, where you got number.
Okay, okay. Sir, my primary strategy in this time was actually reviewing the previous year topics and previous year questions a lot, because INICT likes to repeat their questions and their topics. So I knew that repeating topics would actually be a good strategy to do. Apart from that, I did lots of questions, because that got me into the frame of how INICT thinks, how the paper setter of INICT thinks. Because you need to have that mindset before you solve a question, because INICT always gives you multiple correct answers in a question. So you need to choose the best correct answer rather than choosing a wrong one. You have to rule out options. So solving questions was quite important. Apart from that, I mainly revisited my notes to cover the basic concept, by which I can rule out the other options. Nothing very special. It's just solving questions and revision, and you are very good with, unless as long as you have basic concepts right.
Okay, beta, that's great. And at the last, beta, any special message for the your young doctors who are preparing for the next NEET exam, next upcoming INACT examination? Like, why I'm asking this question again, because I feel that you are the best candidate, because you shared in between, you were distracted, you change your path and then again come back. So beta, just share how you handle, because it happens with everyone, every student who is preparing for NEET exam or he is doing graduation, somewhere up and downs are there. So how you handle that part where you were distracted?
See, first of all, a student has to realize that this happens with everybody. Just because another person does not show this doesn't mean that they are not going through it. And the second thing is, if you're clear that you have to do this, like at that time I was not clear, so I was not doing. True, as that's true. But when I made it clear to myself that I have to do this, I started sitting. Of course, the momentum takes time to build up, but then you have to start any day. If you're sure you have to do it, then you have to do it. You just start with baby steps, and yes, you will eventually reach where you want to be. Maybe somewhere late, maybe later than somebody else, but then you will reach. So just
Absolutely.
take it practically. You do not need to get too much emotions inside it. Just do your job, and then let the results speak for themselves. If they are in your favor, well and good. If they are not, you can always try again.
That's that very true. Okay, we should try and we should feel it happens with everybody, because I have seen many students, they create unwanted pressure with this thought process. Okay, this is only happening with me. No, It happened with everyone, and like you are the topper. बेटा हमारी बातें ना कई बार स्टूडेंट्स नहीं मानते. आप यू आर द रैंकर, तो आपकी बात ना डायरेक्टली कॉर्टेक्स में एंटर करेगी. हाँ यार, ये बंदा सही कह रहा है. So yes, this is strong message from this discussion. Okay, we should take it in a very positive. But at last, any special message for your parents because of whom you are on this platform?
I would just like to thank them because of everything they provided to me all this time without asking me what I'm doing with it, what I'm not doing with it. They never doubted myself. I've had too much fun in my college life, but then they never stopped me from having fun. They never stopped me from studying. They never stopped me from anything. They've always provided support to me to do anything and everything I want. So I guess they get their due thanks from me on this platform at least.
So better convey our wishes to them, and I feel that this is their success. This rank of 108 is their rank. Yeah.
Thank you.
At the last, any special message for the Dams family? Better.
Well, I would just say that they are doing a great job in teaching the students for these many years. I think from 1999, right?
Yeah.
Yes, yes, sir. So they are doing a wonderful job in teaching students, and I think they should just keep it up. I at my position cannot give any advices or such, but they're just doing a wonderful job, and they can always keep it up.
Thank you, Beta. Thanks for all these words, and thanks for coming on this platform, Beta. We wish you very best of luck. Thanks a lot. Thank you, Beta.
Thank you, sir. Thanks.
Thank you.